Welcome back to Joint Decisions. This is a web chat series to educate and empower people who are living with moderate to severe rheumatoid arthritis. It's sponsored by Janssen Biotech and Creaky Joints. The goal of this chat is to provide people who are living with RA and their caregivers tools and resources that they need to have an active role in their management of their RA. The educational content of this web chat is not intended to be taken as medical advice, and it should not replace the recommendations and advice of your doctor. And any questions that are specific to your health or medication should be discussed with your own healthcare provider. Participants in today's chat were compensated for the time they spent collaborating on the content for the Joint Decisions program. I'm Dr. Laurie Ferguson, and I work with creakyjoints.org. Those of you who are members, welcome. Those of you who are not yet members, I encourage you to go to our website, creakyjoints.org, and sign up. We are a vibrant online community, one of the largest in the world, and our aim is to provide support, empowerment, and advocacy for people living with RA and related diseases. So we do hope you will become a member. In our first web chat, we talked about how important it is to be treated by a rheumatologist for the management of RA. And in our second chat, we explored the topic of biologic medicines for moderate to severe RA, and we talked about how they can be administered in two ways. First, by infusion, by a healthcare professional at a doctor's office or infusion center, or by self-injection under the skin at home after training. And we also had the pleasure of speaking with the TV host and comedian Matt Eisman about his experience living with RA. And we also had Dr. Rebecca Callis, a board-certified and practicing rheumatologist. And now for our chat today, we're going to be joined by Liz Schultz. She's a rheumatology practice manager, and her work is to help patients work with their own insurance companies so they can pay for their treatments in Dr. Callis' practice, which is located in River Valley Rheumatology and Infusions. Hi, Liz. Welcome.
Hi. How are you doing, Dr. Ferguson?
Well, glad to be here.
Thank you. Thank you so much for inviting me to participate in this chat. There is so much going on in the life of a person living with or newly diagnosed with moderate to severe RA. It can all be so overwhelming. My hope is that our chat today helps people better understand their health care coverage, whether they have commercial or private health insurance, Medicare, or have purchased their insurance through the health insurance marketplace, or if they are uninsured. Patients need to understand that coverage purchased on the health insurance marketplace is considered commercial or private insurance, and cost support programs may be available to help them pay for the cost of their medicine. Also, to understand the types of resources available to help pay for the treatment that is best for them, regardless of the health insurance coverage that they have. And lastly, how to navigate the annual enrollment period and to make benefit selections so that people living with RA can make good coverage decisions that's right for them.
Wow, Liz, thanks. We're going to be excited to hear from you throughout the chat. We've titled it, Benefit from Your Benefits, How to Make RA Treatment More Affordable. So that's what we're going to dive into pretty soon. As we said, there is no cure for RA, but biologic medicines for moderate to severe RA can help reduce inflammation in your joints in order to relieve some of the pain and the stiffness, and there's been some research that shows it can prevent or slow your joint damage. So just as biologic medicine can be given in two ways, there are two ways to pay for biologic medicines based on how they're taken. First, there's medical benefits that cover biologic medicine given by infusion or injection by a healthcare professional at a doctor's office or infusion center. And second, there are pharmacy benefits that cover prescription biologic medicines that you inject yourself at home after you've had training from your doctor. One of the things we're going to be doing throughout the chat is hearing from you in a poll, and we're going to start with our first question. We want to know what kind of health care insurance you have. It's going to show up on your screen, and if you have commercial or private insurance, click 1. If you have Medicare, click 2. Medicaid, click 3. If you're not sure what kind of insurance you have, click 4, and then press the Submit button at the bottom of the screen. Again, commercial or private insurance, Medicare, Medicaid, or not sure. Then click Submit. And our poll results are in. 68% of you have commercial or private insurance, 26% of you are on Medicare, and 5% of you are not sure. So most of you have commercial or private insurance, followed by Medicare, and we're going to focus our attention mostly on those types of coverage today. During this chat, we're going to review the difference between medical and pharmacy benefits in detail for those who have commercial or private insurance and Medicare, and we're going to explain how Medicare supplement programs work. We also want you to have the knowledge you need to review your benefits carefully during open enrollment so you can help make the kind of coverage decisions that are right for you so you have the coverage you need in 2015. And it's important to note for that even if you keep the same health care plan for 2015, your benefits and your out-of-pocket costs can change. Liz is going to help us understand all of this. So we're ready to get started, and so here's a snapshot of what we're going to discuss. First, the differences between medical benefits and pharmacy benefits and the types of treatment they cover for commercial or private insurance, and similarly under Medicare Part B and Part D. Then we're going to look at Medicare supplement programs and how they work. And finally, we're going to talk about open enrollment planning and what you need to know to be prepared for open enrollment and what deadlines you need to be aware of. We're going to cover a lot of information today. And you may want to take some notes, and that's fine, but also be aware that there are going to be a lot of resources on the information that's presented on the website, creakyjoints.org/joint decisions. So you'll be able to get a lot of the same information there. And there's also going to be a recording from today's chat that's going to be posted in the near future. So you can go back and refer to any information you need. So feel free to take notes, but know if you can't get it all down, there is going to be a place for it. We're also going to have the opportunity to take some of your questions. And if you'll note, the toolbar that's at the top of your screen if you're in full screen, or on the right side if you're in split screen mode, you can find a place to submit questions. Submit them to all panelists. We'll get to as many questions as we can. Please don't ask anything about specific brands of treatment, but we will try to answer as many as we can. So as we're kind of getting ready to go into this, we're going to ask another poll question. So keeping in mind that biological medicines can be given in two ways that we've already outlined, we want to find out how many of you know what types of insurance benefits cover these medicines. So, 1, medical benefits provided by commercial or private insurance cover biologics. 2, pharmacy benefits provided by commercial or private cover biologics. 3, Medicare Part B covers it. 4, Medicare Part D covers it. 5, all of the above insurances cover it. Or 6, you're not sure. And then be sure to click on that Submit button. Again, which insurances cover biologic medicine? And the 1, 2, 3, 4, all of the above, or you're not sure. Waiting here for the results to come in. Just takes a few moments to find out which medical benefits covered. Here we are. So 18% of you said that medical benefits provided by commercial or private insurance cover it. 12% said pharmacy benefits provided cover it. None of you think that Medicare Part B covers it. 6% of you think Medicare Part D covers it. 47% of you think all of the above. And 18% of you aren't sure. So the answer is that all of the above cover it. And so it's important to note that some biologic medicines may be covered by both medical and pharmacy benefits. And so this is why we take the poll, and the results show why this web chat's so important, because figuring out the coverage that's best for your situation can be complicated, as we all know. And so today's chat's going to help you make those health plan choices that are right for you so you can get the coverage you need for at least 2015 and we hope beyond. So now that we have a sense of the audience awareness about coverage, Liz is going to talk a little bit about some key terms that are related to the insurance benefit.
Yeah, so before we get started, I want to just go ahead and define some of these terms. The copay is the set dollar amount you pay for your medicines before your insurance begins to pay. Your deductible is what you pay before your insurance begins to pay. The out-of-pocket maximum is the total dollar amount you paid for your medicines and healthcare services during the year. Then there's your coinsurance. That's the amount you pay after you have met your deductible, usually a percentage of the amount your health plan will pay. Generally, it's a typical split is like an 80-20 split where your insurance pays 80% and the patient would pay 20%. And then there's the annual drug benefit limit, which is a cap on the drug benefits your insurance will pay in a year while you're enrolled in a particular health insurance plan.
Okay, thanks, Liz. So now we've got that basic understanding of some of the coverage language that we're going to be using tonight, and most of you, I'm sure, have already heard that used. So let's go in depth on the difference between medical and pharmacy benefits, and let's start by examining medical and pharmacy benefits for people with commercial or private health insurance.
Okay, yeah, there is often a lot of confusion or a lack of awareness about the differences between pharmacy and medical benefits, and this is a critical point to understand in navigating and selecting your benefits to most adequately cover your biologic medicines, as your cost can vary depending on how the biologic medicine is given to you. That's because how it is given to you determines how it's covered. In some cases, your biologic medicine may be covered by both your medical and pharmacy benefits. We'll talk about this and why it's important in a moment. Medical and pharmacy benefits are very different.
Okay, so Liz, can you explain to us how medical benefits actually work?
Yes, I can. So medical benefits cover biologic medicines given by infusion or injection by a doctor or healthcare professional at a doctor's office or infusion center. And coverage includes the cost of the biologic medicine and the cost to give the patient their infusion or injection. So generally speaking, your medical benefits include these out-of-pocket costs. It may include an annual individual or family deductible, and this is determined by your health plan. It may include a copay or coinsurance amount you pay towards the cost of the biologic medicine, and a copay or coinsurance that you pay towards the cost of the healthcare professional to give you your infusion or injection. If your plan includes an annual individual or family out-of-pocket maximum for all your healthcare costs and you reach it, you and your family may have no further medical costs for the year. So your treatment costs for both the medicine and the administration may be at $0 after your maximum out-of-pocket costs are satisfied for the year.
Wow, okay. So are there ever situations where the biologic medicine is covered fully under the medical benefit?
Yes, there certainly are instances where biologic medicines given by a doctor or nurse are covered at 100%. It's really important to be proactive and check with your plan to confirm any remaining deductibles, cost-sharing amounts, and other requirements that you may have with your plan, like a prior authorization needed to get your medication.
Okay. So if medical benefits cover both injection and infusions given by a healthcare provider, how do the pharmacy benefits differ?
Well, pharmacy benefits cover prescription biologic medicines that are injected by a patient themselves at home after training by their doctor or another healthcare professional. Sometimes pharmacy benefits will also cover and pay for drugs that are dispensed by the pharmacy but brought to the doctor's office for administration. These biologic medicines are just like other prescriptions you get, typically filled and picked up at the pharmacy or delivered to you at your home. With pharmacy benefits, there is a copay or a coinsurance amount you pay for each prescription or refill that you get. For some of you, there may also be a limit for how much your pharmacy benefit prescription plan will pay in a given year for your prescription medicines. It's important to check if your plan includes an annual benefit limit in 2015. As a final point, I want to note that some biologic medicines may be covered under both medical benefits and your pharmacy benefits. check your plan because costs can vary depending on how it is given to you or taken. So to recap some key points from our discussion, please see the Make Sure You're Covered brochure available for download on the website, which is www.creakyjoints.org/joint-decisions.
Great, Liz. So already, I mean, we're just sort of beginning to get into it, and I can see there's a lot of information for everybody to take in. So that difference between medical and pharmacy. And I'm just going to take a moment here. If any of you are starting to have some questions, might be a good time to go to that place on the toolbar and pull down the question and submit it to all panelists, and we will hope to get to it. But you know, just keep track of your questions as well as you're keeping track of this information. So before we move to our next topic, Liz, would you provide an overview of medication cost support programs that are available to patients with commercial or private health insurance?
Sure. So medication cost support programs are available to help eligible patients with commercial and private insurance save on their out-of-pocket costs for their biologic medicines. These cost support programs are usually available for medicines covered under both pharmacy and medical benefits. Manufacturers of biologic medicines often provide information about cost support programs or options for their medicines. An affordability reference guide to medication cost support for biologic medicines based on insurance coverage is available again at the website, www.creakyjoints.org/joint-decisions, where you can find sources for cost support, including independent foundations that can help patients save on the cost of their biologic medicines. It's also important to understand that since Medicare is funded by the federal government, patients with Medicare and Medicaid coverage are not eligible for any of the manufacturer cost support programs.
Okay, thanks, Liz. That's some really helpful information for people to get, that they can get that kind of cost support. So I'm going to ask members of the group who have the commercial or private insurance about their experience with the cost support program. If you have private or commercial insurance, have you ever used the manufacturer's medicine cost support program to help cover the cost of your medicine? Please answer yes or no and click submit. Again, yes or no if you've used the manufacturer's medicine cost support. And we know about half of you have that, commercial or private insurance. So 47% of you have used that, which is terrific, and 53% have not, but there is that opportunity now available because these programs can provide the support to those who are living with RA to offset the cost of the biologic medicine. So thanks for letting us know that. So this is great information you've given us, Liz, for the commercial or privately insured, but we know a number of people on the call and also who may listen in to this once it's on the website are living with RA with Medicare coverage. Are patients using Medicare covered differently based on whether they receive their biologic medicine by infusion or self-injection?
Well, Medicare takes an approach similar to commercial or private health care insurance, and it has benefits using Part B and Medicare Part D. Medicare Part B, in a nutshell, covers a portion of the biologic medicine and covers a portion of the cost for the healthcare professional to give the patient their infusion or injection. Here's how Medicare Part B works. First, the patient has an annual deductible that they have to pay first. Then Medicare covers 80% of the allowed charges, leaving a balance of 20% to the patient that the patient either pays or their supplement insurance would pay. Supplemental coverage may be available for patients with Medicare Part B. This is called a Medigap plan, and it may be available to help you save on the annual deductible and co-insurance costs. In fact, your out-of-pocket costs may be as low as $0 with some Medigap plans. Support may also be available from independent foundations to help with the cost of biologic medicines. Additionally, instead of Medicare Part B, a patient may choose a plan called Medicare Advantage. This is also known as Medicare Part C, and it may be available to help pay for the biologic medicine infusion or injection costs. However, there may be limits with how the Medicare Advantage plan applies to biologic medicines. If you are enrolled in a Medicare Advantage plan, you cannot enroll in a Medigap plan and vice versa. So here's how the Medicare Advantage plan works. A Medicare Advantage plan can replace original Medicare, that's Parts A and B, and prescription drug coverage Part D. So if you have other prescription drug coverage, you can enroll in a Medicare Advantage plan to replace Medicare Parts A and B. If you enroll in a Medicare Advantage plan and want prescription drug coverage, which is Part D, you must get your prescription coverage from your Medicare Advantage plan provider. A Medicare Advantage plan cannot be used in addition to other Medicare benefits. This is a common misconception with my patients when I'm talking to them about their insurance, and I have come to refer to the Medicare Advantage plans as a replacement plan so that they know that when they have that, it takes the place of their Medicare Part A, B, and D.
Wow. I wish they'd gotten catchier names than letters of the alphabet. So thanks. You've really kind of explained that out for us, all these differences. And again, this is going to be written down in the brochure that you can get from the website as well. So can you explain a little bit about the Medicare prescription drug coverage, or what's called Part D? Catchy name.
Yeah, isn't it? You have to know your alphabet when you're dealing with Medicare. So, yes, Medicare Part D serves to cover prescription biologic medicines that are filled by a pharmacy and picked up by a patient or delivered by a pharmacy, then injected by a patient in their own home after training by their doctor or another healthcare professional. Part D plans can be purchased separately if you are enrolled in the original Medicare, which is Parts A and B. And if you are enrolled in a Medicare Advantage plan, you must pick your Part D plan offered by the Medicare Advantage plan if you have one.
Okay.
So here's how Part D works. First, the patient pays an annual deductible. For 2015, it's $320. Okay. Then once the deductible is reached, the patient pays on average 25% of the cost of their medicine, and Medicare pays an average of 75% until they reach the coverage gap, which this is known as the donut hole. In the coverage gap or donut hole, patients pay 45% in 2015, and the Part D program pays the rest. So the biologic company pays 50% of that, and Medicare will pay 5%. Once the out-of-pocket expenses for the year reach another limit, the donut hole closes and the patient pays 5% of the cost of the medicine, and Medicare pays 95%. Under this formula, there is no annual limit on costs Medicare will cover for the medications. Cost support may be available for patients with Medicare Part D. Patients with limited income and resources may qualify for Medicare Extra Help or the low-income subsidy. There is also support from independent foundations that may be available to help with the cost for biologic medicines. So instead of Medicare Part D, a Medicare Advantage, the Medicare Part C plan, may be available to help pay for the biologic medicine. However, there may be limits with how the Medicare Advantage plan applies to biologic medicine. If you have a commercial supplement plan, such as retirees' health care insurance benefits, you may be eligible for pharmaceutical manufacturers' cost support programs. We know this can be so confusing, so for more information and to download the Make Sure You're Covered brochure, visit the website. Again, if you haven't written it down, it's www.creakyjoints.org/joint decisions.
Great. And Liz, I just want to give a shout out to your profession as well, because I think another thing that's provided, often if you go to your rheumatologist's office, there's going to be someone like you who's handling some of this, and a practice manager who can help people sort through some of this.
Yes, thank you. There are. I work with a lot of other managers at rheumatology practices around the country, and I can assure the patients out there that there are people in almost every rheumatology office who have a good handle on what patients need and can give them ideas of where to go to get the insurance coverage they need.
Great, and also have an idea about the difference we're even talking about between medical and pharmacy benefits when they look at that. So in terms of that, we've got another poll question. How would you rate your satisfaction with your current health insurance plan coverage for your RA treatment? Are you very happy? Is it generally adequate? Are you neutral about it? Is it generally inadequate? I need to consider other options. Or are you already ready to shop for new insurance? So your options are very happy, generally adequate, you're neutral about your insurance coverage for your RA treatment, you find it generally inadequate. That's one of the reasons you're here for the chat, is to consider other options, or you definitely know you need to shop for new insurance. And then please click that submit button. Those of you who may have answered the poll but are thinking about your questions, this may be a good time to take a moment and click on that toolbar and submit a question if you have it. So 19% of you are very happy, 38% find it generally adequate, 19% of you are neutral, 19% find it generally inadequate, and you're thinking you need to go shopping, and 6% of you are ready to shop now. So this really tees us up nicely to go into the next part of our conversation tonight about the open enrollment.
Yeah, so it generally looks like people are interested in looking around. So it's a good time for you to review your insurance options. You still have time to make changes and find a new health plan for 2015, as it looks like many of you are thinking you need to. So open enrollment is currently in full swing. Open enrollment is the opportunity every year to make changes to a health plan or sign up for a new one altogether. Most commercial or private insurance has an open enrollment period in the fall, although some are held in the summer. For the Medicare open enrollment also starts in the fall, and the health insurance marketplace open enrollment starts in mid-November. I'll give you some more specific dates here in just a little bit. Now is the time for patients to make sure that they have the health insurance coverage they need so that they can continue to get their prescribed biologic medicines in 2015. Even if you're not planning on changing your plan, your coverage for 2015 may be changing. So I have to stress that this very much. It's really important that you check your cost sharing and your coverage to ensure that your physicians and medicines will still continue to be covered. It's really important, even if you are just renewing a plan through your job, for example, to review the benefit coverage in detail to ensure that you have the coverage you need. I mean, did you know that you can keep your same coverage, but your out-of-pocket costs can change, even if your plan does not change? Coverage and cost for the biologic medicine may be different next year. You may need to call your health plan representative to get this information.
Wow, thanks, Liz. So what are some of those dates and deadlines that we should be aware of in terms of open enrollment?
For commercial and private insurance, dates can vary, but generally start in October. Most plan decisions must be made by November 30th, so check with your plan. Medicare open enrollment started October 15th and ends December 7th, so you still have time to make changes there. The health insurance marketplace, which is at healthcare.gov in many states, starts November 15th and ends February 15th of 2015, so check with your plan. If you purchased your health care plan through the health insurance marketplace, you have private insurance, call your plan to find out if you qualify for the subsidy on paying your premiums or your out-of-pocket costs. Open enrollment is the time to make sure you and your family have the health insurance coverage for your health care needs. To do this, it helps to get organized and get proactive. We have created a free brochure available for download on the website, and again, that's www.creakyjoints.org/joint decisions to help you get through this process. Here are some helpful tips that I give all my patients. So don't worry about writing these down. They're all part of the program resources. So first, make a list of all your medicines for both you and your family. Check your plan options for next year. Make sure your doctors, medicines, and treatments are still covered and at what percentage. If you have questions, contact your plan representative. Determine your deductible, copay, and coinsurance, or your out-of-pocket maximums, and any premiums or any other costs that you have that your plan has. Use the tools available for you, including those provided at the website, to get organized. You can use the free Make Sure You're Covered brochure to learn more and help determine your costs for 2015. This brochure is available for download on the Creaky Joints website. And I can't stress this one enough. Before you sign on the dotted line with a new insurer, contact your physician's office to make sure they are covered under the insurance network and that your coverage will work well for them. Don't hesitate to reach out to your doctor's practice manager. There are people like me in rheumatologist's office everywhere. We understand benefits and the processes involved and can be a helpful resource for you. Ask to speak to somebody else who has the same insurance and can provide a reference if you'd like. Also, if you are uninsured, look into other resources such as independent patient assistance foundations and your eligibility for them. Most manufacturers have independent patient assistance foundations. For instance, Johnson & Johnson Patient Assistance Foundation is at www.jjpaf.org. Finally, as part of your preparation for open enrollment, ask your doctor if you may be an appropriate candidate for a biologic medicine in 2015. This is an important consideration in making sure you have the coverage you need for next year.
Wow, Liz, those are some great tips. So it really is about being organized, being sure you know what your medicines are and how they're covered, and you also suggested not only speaking to a practice manager, but sometimes the health insurance representative, using that 800 number and getting that, and really just kind of going through all that information so you're sure as you look at what you have and what you need, that you're not going to have some kind of gap there. So thanks. So whether or not you make changes to your commercial or private health insurance this year, you're going to be committed to that plan until next year's open enrollment. And the open enrollment for 2016 is obviously going to open up next fall. And you're committed unless you experience a life event like getting married or having a child. So if your 2015 open enrollment period is still open, this is actually the time to make sure that you're going to get that right coverage so you can continue to work with your rheumatologist so you can manage the treatment of your moderate to severe RA in the coming year. If you enroll in a Medicare Advantage, that's the Medicare Part C plan, you can reconsider your plan selection up until February 14th. And then you have the option to return to the original Medicare and consider adding a supplemental Medigap plan, or you have the option to purchase another Medicare Advantage plan. So there is a little more time and wiggle room if you're doing that. So we've covered a tremendous amount of information here, and so now we're going to get to some of the questions about access that you've already sent us through the chat. We know this is a very complex topic. Liz lives this every day. I live it a little bit with my patients, but don't feel that any questions are not good ones. Feel free to ask us those questions, and also feel free to go back to the website that we've mentioned several times for more information on all the things that we've talked about. So one thing that affects payment is where the medication is given. That's something we talked about at the beginning. The discussion talks about in the doctor's office. Is an infusion center considered the same as the doctor's office for this determination, Liz?
So it is under the patient's medical benefits if it's done in an infusion center. Their insurance may have a little bit of different cost sharing for infusion center because it might be hospital-based, but that would still be on an outpatient basis, so they would just need to check with their plan, but it would be covered under their medical benefits.
Okay, so under medical benefits, it's considered that. But as with everything, please don't take this as a beginning, but check with your own plan and your own doctor's office.
Yes, of course. Always do that.
Right, exactly. So Liz, here's the second question. After seeing the response to the poll questions, I'm wondering why more people have not used financial support from the biologic drug companies' assistance programs. Why might that be, in your opinion?
I'm really surprised by that, too. I always give that to all my patients, whether their insurance is going to cover it 100% or not, because coverage you never know when it's going to change.
Right.
They need to ask their practice manager or even the infusion nurse, she would know about it, if there is a copay assistance program through the drug company. Always ask questions. People on the staff will be happy to answer them. Or also go to the pharmaceutical website, and they will list their foundations and their rebate programs that they offer on their websites as well.
Great. So again, there's a lot here about asking questions, and this is the drum I always beat, but I know it's a lot to simply live with the disease. I would encourage you to have somebody who kind of is your wing person to help you remember to ask these questions too. Also, as we discussed in the very first chat, the more you can write down, it may occur to you at some point, and just kind of keep track of that. Those are just some ways to, again, as you said so well, Liz, to stay organized. So here's another question. If you're covered by your employer's health insurance, but that doesn't cover or adequately cover the cost of biologics, what are your options? Can you get supplemental private drug insurance like Medicare Part D, or are there other options?
So sometimes I'll have patients who actually have two commercial plans, like maybe one under their own name through their employer, and maybe their spouse is offered an insurance as well. I would suggest for them to look in that way to see if they can get double coverage that way. But again, I would have the patients look into the copay assistance programs through the pharmaceutical companies, whether the medication comes from a pharmacy and is delivered to their home that they give themselves, or it's delivered in the office by a professional. There are rebate programs from all the manufacturers of biologic medicines that's available to help cover the costs of their medications. And,
I think that is so helpful. It's one of the things, maybe people don't even know that they can do that. So go to the website, and it's there for you. So Liz, this is kind of a basic question, but it's one I keep wondering about. How can patients determine whether they should be using medical or pharmacy benefits to cover their medicine?
So it's going to determine how the drug is given, whether it comes from a pharmacy and it's shipped to their home and they do it themselves. That would definitely be under their pharmacy benefits. And then if it's administered in the physician's office is when it would be under their medical benefits. It's truly in the way the medication is given.
Okay, so that's how you make that determination. How you're taking the medicine is going to make clear which benefit you're going to use.
Yes,
Okay.
That is.
So here's someone asking, if I have commercial or private insurance, what's the best way to figure out how much my medicine is going to cost me?
So generally, once the doctor prescribes the medication, we will contact the insurance company to find out how the medication is covered, which determines the patient's plan based on their either out-of-pockets, if it's in an infusion, or their copay or refill amount per drug. And then we will call the patient and go over that. And again, at that point in time here in our office, we always notify the patient about the rebate programs, so that can lower their copay or out-of-pocket costs for each of the medications.
Okay. So here's someone who asks, what do I do if I miss my plan's open enrollment period, but I still need help covering the cost of my medication?
Again, it sounds like I'm kind of banging the same drum, but the rebate cards are a great tool for these patients. They do offer high dollar limits to help assist with those out-of-pocket costs and even the copays for refills on medications that are shipped to their homes. If the doctor's office does not offer you the card, again, go to the pharmaceutical company's website because you can truly sign up through their websites for their rebate programs as well.
Okay. Again, we're so excited about being able to promote this. So here's a question back to the language you were using. What's the difference between copay and coinsurance?
So a copay is a set fee that's paid every doctor's visit, or that's your copay for a refill at the pharmacy. That's a set amount the patient must pay for your office visit. So like say it's a $20 copay. That's what you pay every time you go to the doctor. A coinsurance amount is a percentage amount that you share and split with your insurance company. And a traditional one is an 80-20 split where the insurance would pay 80% of the allowed charges and the patient would then pay that 20% left over. But there are many different splits, but that just happens to be the most common. But that's what a coinsurance amount is.
So that's what you're really sharing with your insurance company in terms of the ongoing payment for something.
Correct. And typically with a lot of plans, you have an out-of-pocket maximum that once you reach that, then your insurance would pay in full 100% for your medical benefits.
Okay. So someone is asking, how do I get access to my health plan's formulary or list of covered drugs, which would be an important question during this open enrollment period?
Yes, it will. So back in the old days, you used to actually get like a booklet that listed everything, but they don't do that so much anymore. So you generally have to go to the website and look at your plan and see what is covered under the plan that your company or you're looking to purchase is offering. If you can't find it there, there's usually an 800 or a customer service number that I would suggest patients call with specific drug names and find out how it's going to be covered and what tier it's on, because that will determine your copay or coinsurance amount.
Okay, that is such a great idea. I mean, some of us scrolling through a website is just so overwhelming. So to be able to call with your own specific prescription, but then say again what tier it's covered on.
Yes, because so for pharmacy benefits, they have different tiers for their prescription medications.
Right.
And depending on what tier it is whether it's going to be just like a $5 copay or $25 copay or a coinsurance amount where you'll actually be splitting a percentage of the cost with your insurance company. So you do need to find out what tier the benefit is on. And also at that point, you'll find out if there are any prior authorization requirements. And most of the biologic medications do fall into a higher tier, meaning there's a larger out-of-pocket cost, and they do have requirements for prior authorizations on them.
Okay, and just to go back and underscore your very helpful advice earlier, even if you're happy with your insurance and things are going well, this is the time to go and check that, because I have a number of patients for whom this is shifting in 2015, and so you do have to make that phone call even if you're not going to change your plan. Yes.
So a lot of times right now, employers are renewing their plans for next year, and they're saying, we're staying with insurance company X, we have no changes. You really need to go through your plan and make sure that although you're staying with company X, that your out-of-pocket maximums haven't changed, your copay, your coinsurance, and things like that. And then if you're on a particular biologic, currently, you want to make sure that it's staying on the same tier that it's currently on and that it's still on formulary. And what that means is that your insurance company has made it a preferred medication and it's on formulary, and they will allow you to get it.
Yeah, wow. So here's a question, Liz. Can you speak for just a minute about insurance pre-approval processes and step therapies and what those terms mean?
Yes. So a pre-approval process is a prior authorization. So your doctor writes you a prescription and says you need to be on medication A for your severe to moderate RA. Your insurance company says, okay, well, to be on medication A, you have to do a prior authorization and submit the request and why you want it. And so the doctor's office actually has to do all that work before the patient can actually get the prescription filled. Now, a step therapy is what we call here in our office like a step edit, and it means that, say, doctor wants to put you on prescription A, but you have had to have failed other medications prior to being able to get that other medication, meaning it can't be the first biologic you've been put on. You have to fail other medications first.
Which is, I think it's one of the harshest and difficult things is that idea about step therapy, because, your physician really generally knows what'll work, but sometimes you have to go through those processes and demonstrate that they really didn't help the way they should, and then you can get to the one. But the doctor's office will do the pre-authorization work for the insurance company.
Yes, we do. We do all the prior authorizations. And to go back to your comment about the step therapy, sometimes the doctor is choosing a particular medication because based on the patient's other problems, their other health care issues, a different medication is not appropriate for them, that they must skip over those to go to this other biologic. So in that instance, the doctor will sometimes have to write a letter stating patient can't take these other step therapies, they must go directly to this. So again, the doctor's office will do all that work as well.
Great. So again, it's really going to behoove everyone who's working with their doctor's office to make very good friends with the practice manager so that this can go quickly and smoothly. So here's an interesting question. I have insurance from the health insurance marketplace that I found at healthcare.gov. That sounds like government-funded insurance. I guess I'm not eligible for manufacturer cost support programs. Can you speak to that?
Yes. So actually, that's what we all thought coming into the healthcare.gov and before the Healthcare Insurance Exchange opened. But no, the government has deemed that the healthcare.gov website and the health insurance exchange plans are a commercial or private health insurance. And so patients are eligible for all the manufacturer rebate and copay cards with those programs.
Okay, so if I buy my insurance from healthcare.gov, I'm still eligible.
Yes, you are.
Great. Okay. Someone wonders if they change insurance plans, will my new plan cover my biologic medicine?
That would be something they need to check before they sign on the dotted line for the new premium. Insurances can choose to cover certain medications and choose not to. It's the type of plan that you choose. They can make the carve-outs as they want them to be.
All right. So again, we're back to your, we could kind of bold and capitalize, do your research.
Yes, you have to do your research.
Well, Liz, you have given us such a helpful insight, both an overview and a depth view of what's really a complex issue, but I feel like I understand it a lot better, and I would imagine all of our participants do as well. Thanks, everybody, for joining for today's chat, and we're so grateful to Liz Schultz for sharing her expertise and helpful advice. Joint Decisions is going to have another exciting web chat in the new year. In a few weeks, we're going to host Right Track RA, helpful tips for continued success in the new year. And we're going to discuss how to stay on track and continue working with your rheumatologist so you can be successful as you manage your moderate to severe RA. And I'm going to invite you again to head over to creakyjoints.org/jointdecisions. You can register for the chat. You can check out all the tools and the resources from our discussion tonight and from the previous two web chats, and that will help you be more informed about your being an advocate and also your management of your RA. Liz, we've just been delighted to have you. Thank you.
Oh, thank you for having me. I just can't stress enough how important it is to be your own activate and be proactive in your health care and really do your research on your health insurance because you're stuck with it for a whole year. And I know it doesn't seem like a long time, but when you have a chronic disease, that is a long time. So really be proactive and do your research.
Great, thank you. So just a reminder, as we said, today's chat and all the Joint Decision chats are posted on creakyjoints.org/jointdecisions. You can also become a member of Creaky Joints. There are many helpful tools on the site that are going to help you during this open enrollment process so you can get the coverage you need for your medicine. Again, we thank everybody who is a participant tonight in listening and asking questions and taking the polls. There's going to be one last survey that's going to come up on the screen. Please do complete it. That's going to help us better serve you in our future chat. It's going to appear on your screen in just a few moments. Thank you for being here.